Hi, Poppy. Dr. Pat Garcia.
Hi.
Welcome to our clinic.
Thank you.
Happy that you're here.
Thanks.
First visit is going to be a little bit long for a first prenatal visit. I'm going to ask you a lot of questions about your health status. I'm going to ask you some questions about your life, things that can impact the pregnancy. And then we're going to do some blood work and a physical exam.
Okay.
As part of that blood work, we think that every pregnant woman should know their HIV status because that's something that can greatly influence the outcome of the pregnancy.
Okay.
So if it's okay with you, we strongly recommend that we do an HIV test as part of your prenatal panel.
Okay.
But it's not just you that we think should know their HIV status. We actually think that you should know your partner's HIV status. And so I'm going to ask you if your partner's ever been tested and if you know that test result.
I think he's been tested. I don't know the result.
Okay. The reason we think that is important is as you have intercourse with your partner, and if he were to be positive, you could acquire the virus. And when you get infected during pregnancy, if that were to happen, that would represent a significant risk of transmitting the virus to the baby. So we'd like to encourage him to get tested, and we can help put him in touch with a place to do that.
Okay.
Great.
Sounds good.
All right. Let's get on with the rest of the exam.
Okay.